I'm Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. And we were about to talk about this week's topic, which are the side effects of low vitamin D that you need to know about. So not getting enough vitamin D can lead to negative health consequences. The good news, though, is that it's relatively easy to get enough vitamin D. Certain foods, including fatty fish, can help you increase your levels, as can sunlight. Specifically, 15 minutes of sunlight on your hands and face each day can do the trick, according to Dr. Donald Ford, a family medicine doctor at Cleveland Clinic. Also worth noting, if it's raining one day, you can make up for it by spending 30 minutes in the sun the next day. Can I just say something about that, though? If you're
isn't that for like fair skin?
Thank you. That's what I was getting ready to say. That's exactly what I was getting ready to say. Like this recommendation is for people who have
I could go out there and get that much. Yeah.
Exactly. Someone like me is going to need a little more time. Someone like Jaimun Hunsu is going to need even more time because melanin blocks all that sun from getting into the skin, so you don't get the vitamin D as quickly. 15 minutes should not be recommended.
But does it need to be more like 30?
I don't know. See, that's the disparity, is that they don't say how much. It's always based on the standard fair skin male. It's always, what if women need more, or what if women need
Western European male?
Does it work faster that way?
Well, I don't know, but the thing is, I don't think it's good advice to say across the board that 15 minutes is for everyone, because melanated people are going to need more time in the sun to get that vitamin D effect. In any event, here are 27 reasons you should consider spending more time outdoors if your doctor mentions that your vitamin D levels are low, which, by the way, doctors are not mentioning when your vitamin D levels are low. That's just not something that comes up for.
Do you get yours tested? Because
I do get
mine, and they tested my little guys, but I, they didn't used to test mine. That's just been the last few years since I have an osteopathic doctor.
You see, an osteopath. That's the difference. Mm-hmm. I was on this site. I'm trying to remember the name of the site. I think it's called, what is it called? Grassroots Health Nutrient Research. And they give a whole, they want people to, it's called Know Your D Number, Patient and Provider Guide to Understanding Vitamin D Testing and Results booklet. And they give this whole chart of how much vitamin D you need in your body to be able to resist certain diseases and so forth.
Ooh, they give you a number.
Yeah. So for most diseases, I think it's like 60 micrograms per deciliter or something like that. Like that's where your blood needs to be in order for you to be resistant to like COVID and a lot of diseases. I have to find that chart again.
Oh, so how does that translate? Does that translate to a blood lead level? Because I'm pretty sure my blood lead levels were not at that.
Your blood lead?
I'm sorry, not my blood lead levels, my blood level of vitamin D.
What were they?
Mine were down. I mean, they've come up recently, interestingly, since I lost weight. So
that's interesting that you said that. Yes. Because that was one of the things on the list. They said that obesity, that's the first one.
Yes, it interferes. And
yes, because
I think for some people, you don't even have to be that overweight for some of us. Yeah.
Well, let's jump into it. So obese men, women, and children.
Number one, obesity.
I know, right? 35% more likely to be vitamin D deficient than normal weight people, and 24% more likely to be D deficient than overweight people. They're saying that's because the amount of fat that the person has is basically preventing the absorption of the vitamin D systemically because it's a fat soluble vitamin. Next on the list is diabetes. People with diabetes, by the way, it says 27, but I'm only reading like 15 of them because it's a really long list and it just goes on and on. And if you want to read the full list, you can read it at your leisure on Urban Health Weekly. So the second one is diabetes. I was saying people with diabetes or pre-diabetes have lower vitamin D levels than those with normal blood sugar levels. Number 3 is heart disease. Heart disease and vitamin D deficiency are known to go hand in hand. Lupus, a chronic inflammatory disease in which the body's immune system attacks its own organs and tissues, is frequently associated with vitamin D deficiency, in part because lupus patients are often advised to stay out of the sun. Preterm birth. In a study of more than 2,000 moms-to-be, women with higher levels of 25 hydroxy vitamin D, which is an indicator of our body's vitamin D stores. Remember, I told you the number was 60. Stores by blood test had a lower risk of giving birth before 37 weeks. Number 6, multiple sclerosis. In 2013, an international team of researchers examined data from 465 people with early stage MS, an often disabling autoimmune disease that affects the central nervous system. They reported that the higher levels of 25 hydroxy D measured on the onset of symptoms predicted a slower rate of disease progression. Number 7, PMS. According to the Nurses Health Study 2, women between the ages of 27 and 44 with a high intake of vitamin D had the lowest risk of experiencing PMS symptoms. The study also found that higher calcium intake was associated with lower PMS risk. IBD, inflammatory bowel disease. Vitamin and mineral deficiencies, including D deficiency, are extremely common for people with gastrointestinal health issues that affect their body's ability to absorb nutrients. Patients with active ulcerative colitis, a type of inflammatory bowel disease, especially those who take corticosteroids, are often deficient in D. Eczema, number 9. Research suggests that children with atopic dermatitis, a type of eczema, have more severe symptoms the lower their vitamin D levels. Number 10, Alzheimer's and dementia. Studies have linked low vitamin D to abnormalities in brain structure, cognitive decline, and dementia. In a recent study in JAMA Neurology, which measured vitamin D and cognitive function each year in an ethnically diverse group of elderly patients, about half of whom had some form of cognitive impairment at the start of the study, lower levels of D were associated with accelerated cognitive decline. Number 11, schizophrenia. There's a strong link between vitamin D deficiency and this mental health disorder. In a 2014 review of 19 studies, researchers found that 65% of schizophrenia patients had low levels of vitamin D, and people with vitamin D deficiency were more than twice as likely to have schizophrenia.
Wow.
Colorectal cancer. Researchers have known about a connection between vitamin D and cancer risk since the 1940s. Let me read that again. Researchers have known about a connection between vitamin D and cancer risk since the 1940s, when a researcher from the Medical College of Virginia demonstrated a link between latitude, which predicts our exposure to sunlight, our main source of D, and death from cancer. More recently, a 2011 meta-analysis that included more than 1 million study subjects found that greater vitamin D intake and higher vitamin D levels were linked to lower risk of colorectal cancer. Pancreatic cancer. People with the highest vitamin D levels were 35% less likely to develop pancreatic cancer than those with the lowest levels, according to a 20-year study of nearly 120,000 people conducted by researchers from Brigham and Women's Hospital in Massachusetts. Prostate cancer. Low levels of vitamin D were associated with advanced aggressive prostate tumors in biopsy patients in a 2014 study in clinical cancer research. Among African-American men, low vitamin D was also associated with a higher risk of developing prostate cancer in the first place. Osteoporosis. Our bodies rely on vitamin D to help absorb calcium and grow bones that stay dense and strong throughout our lives. In fact, more than 50% of women treated for bone loss have an inadequate vitamin D level. Like I said, this isn't the entire list. It's just too long to get into. You can read the whole list on Urban Health Weekly. I'm just wondering, with all the data, why are doctors telling patients to bone up on vitamin D? Why is that conversation still not happening? Yeah, I had a talk with my breast oncologist the other day.
Yes.
And she suggested, because remember I told you that the radiologist decided that since I didn't want the clip, she wasn't going to do the biopsy.
Yes.
So she gave me two options, either the conservative approach of more surveillance or the extreme approach of double mastectomy. Those are my choices.
Gosh.
And I'm just sitting here. I was like wondering at one point, is she going to mention vitamin D at all? Like, is she going to mention vitamin D? Is she going to mention iodine? Like,
Does she think it's
when I
too
heard
late for that?
about that, my comment was that she's giving you the option between taking a brief time out in the corner or death by hanging. So
Wow.
there's like, what's in between? And I think, taking it back to vitamins, there's a whole lot of research and things that we need to know, like vitamin D. What is the optimal source? How much do you have to take? There's about 20 questions that I have. Should I sit outside in the sun? Is indirect light good enough? All of that.
Yeah.
Is there a better time to get your vitamin D during the day?
Yeah. Should you take your vitamin D while you take another supplement? When's the best time? How do you combine your vitamin intakes?
Yeah. And doctors just don't really seem to be, I mean, maybe at the highest level, I don't know, but, and I'm sure that that some doctors are saying it. So I don't want to be unfair and say that all doctors are not saying it, but I'm just wondering why in general, there doesn't seem to be enough, like there's plenty of articles. I don't really see doctors going out of their way and saying, people, you need to have more vitamin D. Oh my gosh, speaking of vitamin D, so I've been taking chlorella.
Yes.
And I have to tell you that, first of all, I started taking the chlorella not because of the vitamin D. I found that out afterward. I started taking the chlorella because of the iodine. Now, the reason I started supplementing iodine was I do this, it's not a procedure, but I do this thing called, I guess you can call it a procedure. It's called thermography.
Okay.
Where, they cool your body. So you have to take your clothes off. It's this dark room and they cool your body way down. And what it does is it takes a picture of the inside of your body, the heat patterns throughout your body. And if you have like strange heat patterns, like you have blood, accumulating in certain areas of your body that's lighting up, because your body will light up blue, yellow, or red. Blue areas are areas that are cool. You don't have to worry about those. Yellow, normal. In most instances, depending on like, if it's around your heart, of course, it's going to be red. There's going to be lots of blood flowing in and out of the air. That's going to be normal. Certain areas are just going to, but let's say you have, in my case, it was a little bit of like something going on with my thyroid a few years ago. And when I went to my primary care doctor and I said, look, I had a thermogram and there was something going on with my thyroid, they found two tiny
nodules.
Two tiny nodules. I think it was like 2 millimeters, and I forget how big the other one was. I think they were tiny. And they referred me to see an endocrinologist to follow it. I mean, there wasn't really anything to do at the time because they were.
Wait, was it your primary care doctor who scanned your?
No. So I did. No, I went to him because the report showed that there was some activity in the area.
Okay.
And then when I told him about it, and he sent me to do the ultrasound.
Okay.
Found the two little nodules. So the thermograph, specialist, she suggested that I start supplementing. Remember I told you this a couple of years ago, I started supplementing with iodine, and you were warning me like, oh, don't take iodine because it could take too much, Remember?
I just remember about sometimes when you have things like I have Hashimoto's, sometimes you have to be careful with iodine when you have that.
And I've read that, yes.
Okay.
But I started supplementing with the iodine.
Okay.
And when I went back and I had a thermogram back in, I think it was March, it's improved.
Wow.
I don't have the issue anymore. Now, it so happens that I didn't see the endocrinologist because COVID happened and everything
Right.
was shut down and all my doctor's appointments got canceled. I just never followed up. I didn't bother to follow up with it. But since then, it has improved. Like from the last thermograph to this one, it's improved. So it went from yellow to like, a light yellow, bluey kind of. And I credit that with the iodine supplementation from the chlorella.
Okay.
Other
How does
thing,
that taste, by the way? Is it like a
it
pill?
tastes, well, it's the powder. I put it in water and I just grit it. I shake it up, I drink it, I hold my nose, and it's not stinky or anything, but it's not
Okay.
tasty.
Right.
It's
You're
not
doing it for the
tasty.
health, not the
But
flavor.
yeah, but in my mind, it's delicious. It's ambrosia because
It's good for your body.
exactly. So I just suck it up. Yeah. So my thyroid, whatever that the issues I was having have improved. The other thing is I was listening to Christine Northrup. This was a lecture. This was like pre-Trump, but post-Oprah. So
See, now that's a very definitive time frame. I know exactly when that is.
That year.
Yeah. So, well, you remember those years.
Yes.
Yeah. So in any event, I was listening to a lecture and she started talking about iodine and how important iodine is to breast health and to the uterus, the reproductive health. And I was like, Mamma mia, that's great. Because I'm taking iodine, I'm supplementing with this iodine. So like, I'm on the right side of this, So then I started looking, because I noticed like when I have the chlorella and I wake up in the morning, because I take it at night, because I just don't want it to affect my food during the day. I don't want to have this taste. So I drink it before bedtime. Like, not like directly at bedtime where I have to get up and go to the bathroom, but like, like maybe an hour or so that I can have my final micturition and then go to bed. That's P for anyone who doesn't know what micturition.
Oh, okay.
And then
You gotta remember that one.
I was writing it down.
I gotta make sure. I'll be right back.
I have to micturate. In any event, and I wake up in the morning and I just feel. I used to feel groggy when I would wake up in the morning, like, oh God, I just need a few more minutes. Oh, I'm so tired. And since I've been supplementing with the chlorella, because before I was just taking iodine and the vitamin D, and then I switched to the chlorella. You mean
like in a supplement, like
drops. I was taking sublingual drops. And I'm taking the vitamin D3 supplements with the K2. And I just would wake up in the morning feeling fine. Do you know what I mean? Like
that bright-eyed, you felt rested?
Yes, I feel great. I feel like I slept for 10 hours. I just feel like, so that's not to say that I wake up feeling groggy after 6 hours, because I don't. But for some reason, I just feel like really calm and really well in the morning, if that makes sense.
Nice. Yes. Everybody wants that. Everybody wants to feel vitalized.
And so I was like, why do I feel so good in the morning? Yeah, I was like, why do I feel so good? And then I decided, I started digging into it. So it's like doing all this research on like, what is it about chlorella? And it's chock full of vitamin D, not D3, because you get D3 from like fish sources, the oil and so, but you get like, I think it's D2 and D12. You get different forms of D, but it's D, it's all D. As well as the iodide, and you get B12, and you get a bunch of things that I just, really had no idea. And nobody tells you this. Like I'm looking
at is chlorella? What is that from?
Chlorella is basically, it's a sea algae.
Okay.
You can take it as a pill, or you can take it as a powder. I just scoop the powder into my water. I shake it up in my container and I just take it to the head. I'm looking at this article, for example, is like sources of vitamin D. And everyone keeps saying sunlight, salmon,
sardines.
Sardines, canned tuna fish, mushrooms, certain mushrooms, fortified milk, orange juice, supplements. I mean, this is not egg yolks. This is not, fortified cereal. This is not the pantheon of things you necessarily want to. What if you don't eat grains? So, that leaves cereal out.
Right.
What if you have egg allergies? That leaves eggs out. Some of these supplements can be pretty expensive. If you get a cheap type of fish oil supplement, you're getting all the mercury with it as well. So if you want a high quality supplement, you got to spend a pretty penny. Do you see what I'm saying?
Yes.
Beef.
Well, so isn't it good to have like sort of diverse sources of food and intake? So you're getting your vitamins and minerals and nutrients from like a variety of plant sources. Isn't that
right?
better?
You want to do that, but what I'm saying is it's not always necessarily available. It's not always available depending on your region, depending on your budget.
Right.
I mean, chlorella is not terribly expensive. I don't recall the price. I'd have to look it up again. But the thing about chlorella is you get it in a pack and you just put a little scoop in your water. It goes such a long way. You can also do fish, but I don't know when's the last time, like I do fish weekly. I do salmon once a week.
I think we discussed my sardine habit.
Yeah, it's very expensive. Have you had a fillet of salmon lately?
Salmon? No, I'm not doing salmon very often. That's too expensive. Yeah, for me.
But that's my point. And if you want high quality sources like that of vitamin D, it costs a lot of money.
Yes.
So I'm just saying, and if you're a vegetarian, you're not eating
this gives you another option. And besides, what are the salmon eating? I mean, that's what.
Well, they're stream fish. They're stream fish. So you're not getting that same mercury like you'd be getting from tuna. Tuna is actually pretty unsafe because of the levels of mercury. Salmon, not so much because they're not ocean fish, they're stream fish. Ultraviolet lamps and bulbs. I mean, these are the kinds of sources that they're recommending. Beef liver. Look, at the end of the day, you should have a diverse, and you could also just lay out in the sun. But again, depending on your time and your amount of melanin, I don't know how much vitamin D you're really going to get. Most of the population is vitamin D deficient and they don't even know it. And the doctors are not having this conversation with people. They're just not. But I guess my take home message here is by the way, Lou, you're being very quiet about this.
Cause I'm perfect. I take every vitamin known to man. I have them. And as I'm working, a lot of them are gummies and they taste good. So I think of them as candy.
I wonder about the bioavailability of these gummy things. And then you're also getting a lot of sugar with that too. But
that is the bad thing.
Yeah. You can't tell my daughter anything about gummies. She loves some gummies. She doesn't like her vitamin because it's like it's a dropper and you fill the dropper up and it's like I make her put it under her tongue and all that. But in any event, she's taking it and she's happy and she's healthy and all that. But I guess the message that I'm trying to drive home is that doctors really need to go back to their basics and they really need to have these discussions with people about multivitamins and food sources, and they just don't do that anymore. Now it's just about like a treatment or some sort of therapeutic. Do you know what I mean?
It's not in preventive and
there's no prevention. It's like, well, we'll wait till you get sick, then we'll give you this drug. I mean, come on. There is an in-between that we can have with people, that people don't have to go down this path of sickness. How many cancers did I just say were linked to vitamin D?
Wow, a lot.
And still, doctors are not saying anything to people. I don't know about, this is not all doctors, but I'm saying like in the regular, run of the mill doctors that most of us see. I'm sure Hollywood doctors are telling their people.
Yes.
And, functional medicine doctors, of course, are telling their doctors, but most of us can't afford functional medicine doctors or these really expensive doctors that are going to tell you, by the way, you need to make sure you get your vitamin D levels up. So anyway, I want people to visit this site. It's called Grassroots Health. It's basically a site about nutrient research, and they give all this great information about supplementation and body nutrients and so forth. And they give you all these different levels and charts so you understand, what your nutrient intake should be like and so forth. It's a very interesting site. And please pop your vitamin D, however you get it. And don't forget about, sources like chlorella, which is a very excellent source. I'm not getting paid to say this.
I'm going to try out chlorella now.
I just want to put it out there. I'm just feeling so good from taking this chlorella that I just wanted to share my good fortune with everyone. That's all. So I'm not recommending a brand or anything like that. Go out there and do what your budget can do. But by all means, people, please start getting your vitamin D levels up. All right? Because remember, you only have one life and one body. So you got to do your best to make it count so your years are full of life and full of health. Remember, information equals transformation, people. So small steps each day and you'll see a difference. I am sure of it. So we're going to sign off. That's all the time we've got today. You guys are amazing as usual. Thank you.
Thank you.
And I will see you guys next week.
All right. Bye, guys.
All right. Bye. Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.